Namaste. Myself Dr. Soumya Hullanavar. I am a Chief Consultant at Diabetes Reversal Clinic, Bangalore. So today I am over here to talk on a topic about insulin. So many type 2 patients are getting shifted onto insulin. So many patients were also asking me like insulin is only for type 1 patients, why I should shift on to type 2 when my sugar levels are not coming under control. So that's definitely a right question to ask. We differentiate the type 1 and type 2 diabetes patients depending on the insulin as that itself is a line for us to decide. Like once you shift on to insulin, there is no difference between type 1 and type 2. So doctor, why should I start insulin injections if I am type 2 diabetes? And why am I not responding to the oral medications or a lifestyle changes or a diet or exercises? There are multiple stages in this when a type 2 person shift on to a insulin. So let us understand what exactly is human insulin. See, we call or we give that a human insulin injection as a replacement for the insulin which is produced in our pancreas or in our organs, in our metabolism. So basically, is that insulin same as what it synthesizes inside our body? I would say no. It cannot be. See, anything naturally synthesized in your body cannot be replaced. So we just know a very, let's say, I would say how much ever our science has discovered, I would say what we know out of 100% is hardly, maybe we could understand our hormones, how they synthesize, how they react, and what is hormonal replacement therapy, because insulin is also the one which comes under the drugs category of hormones. So I would say it's hardly a 10% what we understand. So doctor, how does this human insulin works in the body? That you have to understand first. So basically, whenever you take an insulin in your body, so whenever you are injected that insulin, what does it do is, it tries to help your body by moving that sugar from your bloodstream to other cells or other organs of your body. So what am I doing? I'm just shifting this excess sugar which was there in my bloodstream to the other organs of my body or the other cells where it should be utilized as an energy. Then my sugar level starts dropping. So there is again two possibilities here. So it's always a probability actions are more in diabetic patients. As far as I have been understood with my experience of treating the diabetes patients. So whether like that has to be used as an energy. So I am a person who sit and I have a complete sedentary lifestyle. So wherever my excess sugar, it's in the bloodstream or in my muscles or in my any other organs of my body, then how am I converting that as an energy? That's where the question arises. Okay. So the second thing we call it as this insulin starts working like in the way it reduces the excess sugar production in the liver. So what am I do? Because liver is the one which stores the sugar in the form of glycogen. So it keeps, it's a storage area for our body to keep that energy in a backup kind. So whenever it requires, whenever you get up in the morning, when you start walking, the first person who produces is not your food or anything, that is your liver, which start producing your stored sugar in the form of glycogen. So what does this insulin does is, it tries to reduce that storage in the liver. So what it has to do, it just temporarily subsides that sugar levels. So this is what the major role of insulin. So until and unless either way you take insulin, you don't take insulin, you are not a person who will have a control on the diet, the calories you are taking, the carbs you are eating, and your body has some problem in the in between. There are some many barricades, the converting this glucose into an energy. So there are multiple organs, multiple metabolism happens at the level of your blood cells, your fat tissues, your muscle proteins, the amino acids, the protein metabolism, what we call it as. So unless you don't do any of these changes of utilizing those calories in the form of exercise or diet, then you are nothing like you are type 1 or type 2, you're on insulin, you're not on insulin, doesn't help you to treat diabetes. So please understand, just being type 2 diabetes is nothing more safer than being type 1 diabetes. In both of them, you always have organ complications which end up with a very badly in diabetic patients. So this is about the understanding of insulin role in type 1 or type 2 diabetes. Thank you.